Good evening, and thank you for joining us on blackdoctor.org for Seeing Eye to Eye. I am your host, Shamika Rhymes, and let me know in the chat where you are watching from, and let me know what the weather's like where you are, because it's cold and rainy here. But tonight we're focusing on a topic that affects children's learning, their development, and overall well-being. And we're going to be talking about early vision screenings. Many parents may wonder, who does these screenings? When should they happen? So don't worry, we've got you. Tonight, we're going to talk about the importance of early detection, the differences between screenings and a full exam, and how parents can navigate those next steps when vision issues are found. So to help us see clearly on the topic, let me introduce you to tonight's experts. First up, we've got Dr. Julius Oates. He is an attending physician in the Division of Pediatric Ophthalmology at Children's Hospital of Philadelphia. Welcome, Dr. Oates.
Hi there. It's a pleasure to be here. Thanks for having me.
Thank you for being here. And then we've got Shavette Turner. She is the Vice President of Children's Vision Services at Prevent Blindness Georgia. Welcome, Shavette.
Thank you. Thank you for having me. It's a pleasure to be here.
And I forgot to let the audience know, if you guys have any questions at all tonight, drop it in the chat and we will try to get to those questions. And remember to share this feed, share it on your Facebook, or if you're watching on YouTube, share it there. Share it with your network, because you never know who may need to see it. So let's kick off the conversation. Dr. Oates, why is early vision screening so critical for children, and what are the potential long-term impacts of undiagnosed vision problems?
It's a great question, and I'm excited to talk about this. It's something I'm very passionate about as a pediatric ophthalmologist that provides medical and surgical care for children. And the reason early screening is important is something a lot of the people in the audience probably know already, is that kids can't always tell us what's going on. A lot of eye conditions in children can be asymptomatic, meaning the child doesn't say something or the parents might not notice anything, and it requires a detailed screening exam or full examination to identify. And then the importance of doing it early is that the brain is still kind of flexible and malleable when the child is young. And if there's a condition that could impact the child's long-term vision, we want to catch it as early as possible so that we can initiate treatment and result in better outcomes for the child.
Okay. Well, to follow that up, what are the most common vision issues detected in children, and how can they affect a child's development and learning?
Yeah, so the three most common vision conditions in children are amblyopia, strabismus, and uncorrected refractive error. So I'll go through each of those one by one. So amblyopia is a term that's super common in the medical field, but maybe not in kind of the general public, and often known as a lazy eye, but we generally try to avoid that term because it can mean different things to different people. So when we say amblyopia, what we mean is that either one eye or both eyes doesn't see as well as it should, and that's because the developmental connections between the eye and the brain haven't formed strongly. And that could be because the child needs glasses and they haven't worn them, or the child has an eye that crosses or drifts and the brain's not able to use the two eyes together. So again, essentially amblyopia is when the brain hasn't developed a strong normal connection with either one or both eyes. Strabismus is the second thing that I mentioned. It affects about 3 to 5% of kids, so pretty common. And that just refers to eye misalignment. So that could be the eyes drifting outwards towards the ears, inwards towards the nose, or more uncommonly upwards or downwards. Strabismus can cause amblyopia because you can imagine if the eyes are pointing in different directions, the brain says, wait a second, why are you showing me two corners of the room at the same time? I'm going to shut off the image from this one eye so that I can just focus on a single image. And that can cause amblyopia. And then the third that I mentioned is uncorrected refractive error. So refractive error is just the technical term for needing glasses. So kids could be nearsighted, farsighted, have astigmatism. And uncorrected refractive error refers to kids that would benefit from glasses, but don't have them yet, either because they haven't seen a doctor, haven't been diagnosed with that problem. So those would be the three top vision problems in children: amblyopia, strabismus, and uncorrected refractive error.
Thank you, Dr. Oates. Well, to follow that one up, can you explain the difference between a vision screening and a comprehensive eye exam, and when should a child need the latter?
Of course. So screening is typically thought of as a relatively simple and fast test that doesn't need to be performed by a specialist. And the goal is to identify children at risk of having an eye problem that require a full eye exam. So screening can be performed in lots of different ways. The American Academy of Pediatrics is the kind of national organization of pediatricians, and they have recommendations that essentially at every well child visit, so that's a little more frequently than once a year when kids are first born, and then about once a year when they become older, the child should have some form of vision screening. And the screening can take the form of many different things that are often age related and related to what the child is able to cooperate with. So you can imagine for a very young baby in the first few months of life, they're not going to be able to do much. So the screening recommendation from the American Academy of Pediatrics is to just use a specialized light that the pediatrician will use to look to make sure there's kind of a symmetric, healthy reflex coming from both eyes. If you ever happen to look in your child's medical chart, you might see something like red reflex present. And that refers to light reflecting off of the back of the eye that looks red, which is normal and healthy. As the kid gets a little bit older, they might be able to participate in instrument-based screening. So if you've seen ever a pediatrician use kind of strange handheld device that looks like it's taking a picture of your child's eyes, that would be instrument-based screening. And there's lots of different instruments. But they often have like a little smiley face or play a song to keep the child's attention while they take a picture of the child's eyes and determine if the child is at risk for having eye problems. And then finally, as kids get older, sometimes as young as 3 or 4, but often a little bit older, we'll start having them look at the letters on the chart at the end of the hall. So we're all familiar with the big eye chart. It has a big E at the top, or sometimes it has symbols or shapes. And the pediatrician will essentially have the child cover one eye at a time and test the vision with the vision chart to determine whether they meet kind of age-appropriate vision.
Okay. Well, Chevette, how do you explain what Dr. Oates just said to parents?
Well, we know as a vision services organization, we know, from the parents' perspective, there's a lot that goes home, in that book bag. As a parent myself, I know that, even we're getting, things getting sent home digitally, and parents can be overwhelmed by that. Hopefully at this point, there's a wonderful school nurse that has gotten involved in the process and has, sent you the paperwork home to explain the difference between the two. But what we want our parents to understand is that a screening is, the opportunity for us to, do some preventative, to look at the preventative side of things. We're not diagnosing at this stage. We're just looking, at a safe way of looking at the eye to say, hey, there could potentially be, a problem, and in some cases we've, sent home a referral at this point. We are not diagnosing anything. We're looking at, the parents to, work with us and in partnership at this point to say, hey, let's work together to get you to the next stage. And the next stage would be for us to get the child into care. What we want to do, whether it's for, for us as a vision service organization or the school nurse or the school social worker or health services, partner, whatever it is, whoever it is at the school at this point, is to make sure that we're getting a child from this vision test onto the eye care professional so that we can figure out what the end result should be, whether it's that child wearing glasses, whether it's getting them to some other type of care, but the end result is to get the child to the eye care that they need. So the way that we explain it to them is that we're getting you just a basic test to be looked at, and then getting the child into the care that they need to have.
Chevette, you brought up a point that reminded me of something important so that I tell parents whose kids have a vision screening, which is that the tests are designed to try to not miss a single kid. So what often ends up happening is that a lot of kids with normal eyes end up failing the test. And so the parents can be super worried because they say, wait a second, I haven't noticed any problems with my kids' eyes. They're doing fine in school, but my doctor told them they failed this test and I can't get in to see the eye doctor for a few months. Be worried. And so what I often tell parents is that the tests are designed to try to catch every single child with an eye problem. And to do that, unfortunately, some kids with normal eyes that don't have any eye problems end up seeing the eye doctor.
Wow. I was just trying to think of, growing up when I had, I'm not, without saying my age, I don't remember any of this stuff happening. Then I know I started wearing glasses in like 6th grade because I was having headaches and couldn't see the board. So this is, yeah.
And so one thing, Shamika, that I didn't answer in your earlier question, which was the difference between a screening exam and a comprehensive eye exam. So I talked about all the screening exams, and Chevette covered that as well. And she alluded to the comprehensive eye exam, which is what I perform as an eye doctor for kids and what some optometrists perform as well. And what that involves is a little bit more detailed. So it will be a more standardized assessment of the vision with kind of a calibrated chart in the exam room. Often we have to dilate the child's eyes, meaning we put drops inside of their eyes to make their pupil big so that we can look at all the structures inside of the eye, make sure the eye's nice and healthy. We'll take some measurements to make sure the eyes are aligned. And then finally, we can do a detailed measurement as well to determine whether the child needs glasses or not. So fortunately, most kids don't need a comprehensive eye exam, but kids that are having any symptoms or kids that fail a screening eye exam are the ones where we like to focus on the comprehensive eye exam.
Okay. I'm sorry, Chevette, did I cut you off a second ago? Oh, okay. I thought I did. I'm sorry. Dr. Oates, well, why should children have vision screenings when they could have these eye examinations? And can you talk about the safety and accuracy of the vision screening?
Yeah, it's a great question. So you raised the interesting point, if the comprehensive eye examination is the gold standard, why don't we just do it for every kid? And part of the reason is there's a pretty small number of pediatric eye specialists in the country. So in America, there's about 1,100 of us. That works out to about 1 per 80,000 kids. So if we had every single child need to see a pediatric ophthalmologist, the wait list would probably be, 20 years. The kid wouldn't get in until they're driving already. So that's one reason. And then the other reason is that it truly might not be necessary. A lot of the most common eye diseases that we see or that you might have heard of, like cataracts, macular degeneration, glaucoma, are all age-related. Obviously, there are some common ones that I mentioned before, like amblyopia, strabismus, and refractive error in kids. But most kids that aren't symptomatic don't need a comprehensive eye examination. So it would be really an unnecessary and sometimes uncomfortable experience. I don't know how many of you have ever tried to put eye drops in a screaming 2 or 3-year-old, but no one's happy at the end of that experience.
It sounds very scary. So Dr. Oates, at what age should parents start having their child's vision screened, and how often should these screenings happen, and who exactly performs these vision screenings?
Yeah. So like I mentioned before, the American Academy of Pediatrics has recommendations for essentially every single time the child is seen, and the kind of vision chart screening starts around age 3 or 4, or sometimes 5. There's also kind of an alternative model, which Chevette will probably be able to talk more about, which is school-based screening. The challenge here is that there's no federal guidelines for school-based screening. So every state has different recommendations in terms of what age the children are screened, if they're screened just once or screened every year, if the screening is done with an instrument or done with an eye chart. So there's a lot of variation from state to state, which can make it a confusing thing to navigate. That's why I often mention the pediatrician, as most kids are having a kind of scheduled well child check at least once a year. And the pediatrician should be doing some type of screening examination for the vision at each of those. But Chevette, I'd love to hear if you have thoughts about the school-based.
Mm-hmm.
We do have our program, our Circle of Vision Care for our Prevent Blindness Georgia. We start as low as first grade. In some cases, we have done them younger, but it just depends on the school system that buys into our program. But primarily, we start with first grade. Again, it will depend on the school system. But, for the state, being that there's no mandate for Georgia, the only recommendation, the only state mandate that we have is it's called our Form 3300, and it mandates hearing, vision, dental, and nutrition at the start of entry into the school system. And that's pretty much it, because there's no federal mandate for any other screenings. Then other than that, we have our regular screenings. They try and, use the Bright Futures guidelines to mandate the visits from there. But other than that, there's nothing that mandates them. And then most other programs will do school screenings along those same schedules.
Thank you. Dr. Oates, why are in preschool Head Start school vision screening programs so critical to the detection of vision problems in children?
Yeah, Chevette will probably be able to speak to this also,
Yeah.
but one nice thing about it, similar to the pediatrician's office, is that it's a way to catch the majority of children. So obviously we're missing some kids that might be homeschooled or have other types of circumstances, but it is a nice kind of standardized way to methodically screen every child. And then of course, if the child's in school, we expect that they are using their vision for some of their schoolwork. So there's also opportunities for the teachers to make a comment if the teachers are noticing something about the child's vision. Yeah, so that's my perspective there. But Chevette, I'd love to hear if you have other thoughts about school-based screening.
No, I mean, same. I mean, with Head Start, we're able to work with them in a great number of ways. We actually start with working with Head Start through their advisory, committees. We work with them from a whole child perspective. So we work with them all year around, not just, with their at the school screenings. So we work with them to actually initiate, their vision screening program. So we start at the training level, actually. We train not only their nurses, but their health advisory, individuals. And so, when you start with good training initiatives, you get better outcomes. And so by working with them in that way, we also work with the National Head Start Advisory, National Head Start Association, and we've put together online programs for parents and caregivers. And so by working with the parents and caregivers, we start with that aspect of it. We're able to build better programs with them as well. So I think, overall, working with Head Start has been a great opportunity for us. Other parts of Head Start, just going to get my notes here. With the Head Start organization, I think the most effective part for us as a vision screening organization, a vision services organization, is actually providing the screenings in school with them. We get an opportunity to go in and actually provide the screenings on site for them. And because Head Start has the only, federally mandated screenings, we work with them in that first 45 days of them starting the school. And so we're able to provide them with on-site screenings and then provide them with the results. And then in some cases, be able to go back and provide them with the results, and the follow-up clinic services as well.
Thank you. I do want to remind everyone in the chat, and I see you guys, if you have any questions, make sure you put them in the chat. Chevette, what are some of the common barriers to school vision screening program effectiveness?
Well, I would say that, because there's not anything mandated across, the states, the way that we do it in Georgia is different than the way that we do it in Ohio, than the way that we do it in Texas. It would be nice to see some consistency, across the states, so that, Billy in Texas is getting the same care that, Billy in, Wisconsin is getting, the same. That would be, my take on it. I'd like to see that. The other barriers are that kids just don't have access to care. What we're seeing here is that, a lot of the smaller eye care facilities are shutting down, or they're not able to see kids that are of a certain age. So they'll see kids that are age 7, but they won't be able to see kids that are age 5 and under. And some of those kids are needing care as well, or they're not taking the insurances that they're not, that are able to take, and a lot of parents don't have access, to the vision care insurance that they're used to be able to, because their employers just don't provide it anymore. And so, it would be nice to see that the kids are getting the access to care that they need to have it, but unfortunately, the vision care providers just aren't there. And a lot of the voucher programs simply aren't there as well.
Yeah. Chevette, you bring up a point that reminds me of a lot of patients that I see in my clinic. And I think it'd be helpful to share that there's two types of insurances when we think about vision, right? So there's like medical insurance, which is the same insurance you use when you go to a primary care doctor, when you get lab work. And then there's vision insurance, often called like VSP or a vision service plan. And a lot of times people think that they can only see an eye doctor like me if they have vision insurance. But actually, if a child fails a vision screening exam, it's considered a medical exam and it's covered under your general medical insurance. So even if you don't have, or you don't think your child has specific vision insurance, if there is a failed vision, it counts as a medical diagnosis and should be covered by medical insurance.
Mm-hmm. Yeah, thank you for sharing that, because I'm not sure that those watching know that. So that's helpful information. Thank you. Shavette, can you share some success stories in Georgia with us?
I think one of my favorite stories right now is that we have the distinct pleasure of working with an organization called Rise Augusta, and it's a literacy program. They actually have literacy coaches that are working inside the schools down in our Augusta area. And, it's one of the programs that we work with where we actually, by going inside the schools and providing clinic services, what we call our circle of vision care, where we go in, we've done the screening, we've done, the exams, and then provided glasses for children in some of our lower income areas, where we actually get to compare the literacy scores, year over year. So we've gone in, we've done the work, we've done the screening, and then we saw what the effectiveness is of their program. And, I've gotten to, I checked in with one of our literacy coaches last week, and there's one little boy in particular that, she wanted to tell me about, where, one of the challenging parts for us is getting the paperwork back. If you can get everything in and get all the consent signed off and all of that, you're batting 1,000. And this was one of the ones where it was just kind of challenging to get all the paperwork in and get everything in, but we did it. We got everything all done, and went through all the things and got the consent back, and he got his glasses, and she wanted to do things differently. Instead of, having him come back to class and, just, be in with everybody else, she knew what his vision issues were and just what a difference these glasses were going to make for this kid. So she wanted to have some time with him, just like in their one-on-one sessions, where she knew what the impact was going to be for him. And she said, in hindsight, she's not sure if it was just for him or if it was just for her, but they had that moment together where she gave him the glasses and then gave him the opportunity to, one, read the board, and then also read, in a book. And, you hear the stories all the time where, and I know we hear them because we're a vision services organization and, we do this, all the time. And, Dr. Oates, I know you get it firsthand, but for her, this was her first time, where she got to see one of her students one-on-one, have that magic moment of actually seeing the board for the first time and actually really seeing his books for the first time. So she knows that she's been teaching this student for a long time, and she knows that she's been teaching him for a long time, but this is the first time he actually saw what they were actually doing and what they were actually reading. And for someone who's, a literacy coach, this was a big deal, So, again, she said in hindsight, she's not sure if she did it for him or she was doing it for her, but at the end of the day, they were both crying, I appreciated her sharing that story, with me because, we provide services for thousands of kids, every year. You don't always get the stories back. You get the feels because you get to do it every day, and not that you do it for that. You do it because it's what you're supposed to do. But it's nice to know that, it's not just us out there doing the work. It's, teachers like that, that are putting in the work and really investing in their students and going the extra mile to go out there and really go after the paperwork so that, the work matters, sometimes you don't have to go after the 99, you go after the one, and I'm glad she went after the one because, he wasn't in, first grade, he was in third grade, and it really matters. You really have to catch those things. So I was really grateful for that.
Chivette, I'm glad that you mentioned this idea of a magic moment, because I'm sure we've all seen those videos on social media of the kid that puts their glasses on for the first time, and it's a very dramatic, they like see their mother's face and they smile.
Mhm.
And those are really special moments that happen often. But there are also situations where, like you described, it might take a little bit more time. The child might not like to wear their glasses at first because they're not used to what clear vision looks like. And sometimes parents can feel really discouraged because they're looking for that magic moment. And they're like, oh, my kid keeps taking their glasses off. They keep complaining about them. And so I just like to kind of share the other side of that coin is that the magic moments are awesome. And but I love that story because it demonstrates that sometimes it takes a little bit of work. Sometimes the kid doesn't just immediately see better. Sometimes it takes the brain weeks or even months to get used to what clear looks like and kind of improve the vision. So I just share that in case there are ever parents that feel frustrated if their kids not liking glasses, that it can be a little bit of a longer haul.
Yeah, thank you. Thank you, Chivette. I was like, don't cry. I was like, I love these magic moments so much.
Yeah.
So, Chivette, thinking about the state of Georgia and, of course, other states, what could be done to make vision screening children across the board more effective?
I guess for those to know that there are resources out there. We have, organizations like the National Center for Children's Vision and Eye Health. We have Prevent Blindness. I always say that we're the best kept secret until we're not the best kept secret, and I don't want to be a best kept secret anymore. We do have some excellent resources. We have resources that tells, our families the basics of even how to make a doctor's appointment, how to make, what's to be expected, at your first eye doctor's visit, how to apply for a voucher, what to expect, from all these things. And they're located right on our website. And, our numbers there, our website's there. The basics of the most basic things, or just what is myopia, what's hyperopia, all the things that Dr. Oates, talked about earlier. What is amblyopia? What is strabismus? And then, something as simple that whether a child, passes or fails the vision screening with us, we still give them a letter that says, what are the ABCs of vision? Your appearance, behaviors, and complaints. Kids should not complain of headaches, something as simple as that. So we give them that whether they pass or fail. So parents know that just because my child passed, I still should be looking. Whether my child doesn't pass, I still should be looking. All those things. So all of those things are readily available. Know your resources. Know that you're not alone in this. The moment you say that your child can be screened at any age, you're still in partnership with us as an organization, and that never ends. From zero to the time that they're an adult, you're still in partnership with us. And then adulthood and beyond, you're still in partnership with us.
Thank you. And I'm glad you mentioned the headaches, because the next question, Dr. Oates, what are some warning signs that parents and teachers can look for that might indicate that there's a vision problem? Because remember earlier I was saying I was having headaches, and I know my mom was tired of coming to the school to pick me up every day because I had a headache, until I think it was a teacher that said she might need to go to the eye doctor. I don't think she can see the board.
Yeah, it's such a good point. And Chivette, I love the ABCs that you shared. So thanks for sharing that. So yeah, obviously, if you're noticing anything unusual with your child's eyes in terms of the eye's not pointing in the same direction, if you're noticing a white spot in the middle of the eye, that would be something that you'd want to be seen right away. In terms of actual behaviors that children might exhibit, one could be holding things very close to their face. That can be challenging because young kids are just curious, and sometimes they just like to see things really big and they hold things close to their face. But if the child, for example, likes watching TV from just a few feet away or holds things very close to their face. Another common one would be squinting. So a child could like squinting when they're looking at something, blinking, like excessive blinking, lots of blinking. Those would be some of the most common signs the child could have an eye problem that's undiagnosed.
Could it be, and I'm just going off of like a friend, she said her son is always, she could say, pick up that, ball right there. And it's like he doesn't see it. Or Or is it he's just ignoring her? I don't know which one it is, but
that is the challenge with kids, and that's one of the challenges that we're able to kind of get through with the objective data that we get from a comprehensive eye examination. But we often see, parents that are worried about their child and they have a perfectly normal exam, but better to, at least bring it up with a pediatrician who can do a screening and tell you whether it's necessary to do a comprehensive eye exam, even if it might be just related to the child not wanting to follow instructions from their parents.
Right. So this question is for both of you. Is it difficult getting parents to navigate that difference between screening and a need for an examinations? And what should parents know and do when they get those results from that vision screening? Is there anything that would make that process easier? Shavette, I'm going to start with you.
Sometimes it is. Sometimes it's difficult to get them to navigate the difference between. I think, again, it goes back to there's a lot that goes home, in that backpack. And, you may have, more than one kid, and it's just a lot. But I think, again, knowing that, you're not in this alone, there's that nurse or health services, coordinator that's helping you maneuver that, and knowing that there are resources for you. So yeah, it just, you have to know what your resources are, as a parent, and not being afraid to reach out, Another, just a quick story. We had a board member. She became our board member after her child got diagnosed. Well, got screened by us. Her child's, oddly enough, name was Georgia. And, Georgia was, the youngest of 5, and after you get so many things coming home in all those backpacks, just a lot. But, part of our, process is to not only just send the information home, but we follow up, with phone call and things like that. So after Georgia's mom got the phone call, the second, third one, whatever, she's like, hello, and so she was talking to her about Georgia, and, we talked to her about the screening, and she said, well, I got the paperwork home, but I just, whatever, the normal spiel. And she said, yes, but I need you to follow up with that. Oh, I thought we were done. No, I need you to follow up with that. Georgia had been through all kinds of screenings. Georgia wasn't talking, she'd been through every, kind of screening there was. And she was actually in, speech therapy, because Georgia wasn't talking. And so mom takes her to, finally follows up, takes her to get her vision screened. And clearly Georgia could not see. She works out, with one of the highest prescriptions doctor had seen in a very, very long time. Georgia gets her glasses, and it was one of those magical moments where, Georgia hadn't seen mom's face. Georgia hadn't seen, the grooves on, leaves, those kinds of things. And it's like, oh my gosh, I didn't know that this was what my child was going through, this kind of thing. You don't know what you don't know, because, hey, Georgia has seen this way her whole time. She doesn't know that she's seeing any differently, but, again, then this, of course, to our benefit, mom gets involved, with us as an organization and becomes one of the greatest, of all time. But, again, you don't know what you don't know. And, by mom, getting those phone calls and working with us and, following up, it became a good situation, but she knew to rely on us as a resource. She knew to work with the school nurse and follow up and things like that also. So again, don't take it all on yourself. Work within your network.
Oh, thank you for sharing that story about Georgia. I just have a vision of what she looks like with her little glasses on in my head. Oh,
adorable, as you might think.
Yeah. Dr. Oates, do you want to weigh in on that? If it's difficult getting parents to navigate the difference between a screening and need for examination?
Oh, sure. Well, I was going to say, if you're ever with your child for a comprehensive eye examination, you'll remember, because there might be tears and screams when the child is getting their eyes dilated when the drops go in, which, we do it all the time in adults, and they tell us, it stings a little bit. It doesn't really hurt. But I think sometimes for kids, it's a new experience. It's a stranger, and it can be kind of frightening. So I would say most parents that have had their child have a comprehensive eye examination, don't forget it.
So I guess another part of this, kids today love to watch TV. They love their tablets and iPads, and their video games. So Dr. Oates, how does that screen time impact children's eye health, and what recommendations do you have for managing that?
Yeah, we learned a lot during the pandemic because screen time increased a lot for children. And we're still learning how screens impact the eyes. But the biggest concern that we have with screen time is nearsightedness progression, or myopia is the technical term for nearsightedness. So children that are nearsighted or myopic have near sight, so they can see well up close without glasses, and then they need glasses to see in the distance. And you might say, doesn't sound like a big deal if a kid has like more nearsightedness if they use a device more. But when children or even adults develop high levels of nearsightedness, there's a higher rate of pretty serious vision threatening complications. So people with high amounts of nearsightedness develop cataracts earlier. They're at risk for retinal detachments or tears, which can happen after trauma, but can also just happen spontaneously on their own. There's possibly an increased risk of glaucoma as well. So generally, we would like to prevent children from becoming more myopic if possible. So that's kind of the biggest eye development concern we have about children using screen time. There's obviously concerns about kind of brain development and social development with screen time, but from an eye perspective, the main concern is causing rapidly progressing nearsightedness.
Okay. Well, that also just brought up a question in my brain. Kids that are in sports and they get a black eye, how do you navigate this with parents and to let them know, like, maybe you need to go get their eye checked, especially with the swelling and stuff. Shavette, have you ever dealt with this as well? Having to help parents navigate that?
Not on my end.
Okay.
That's more Dr. Oates.
I do see kids, unfortunately, all the time that have periocular injuries around the eye. I would say the best treatment is prevention. So, if a kid's doing something that has projectiles, something that could hit the eye protection, even if it looks really nerdy and the kid doesn't like wearing their sports goggles, you come to the eye doctor, I'm going to tell you that your kid needs to wear sports goggles if there's something that's flying high speed towards their face. So things like, the helmets that people use for baseball that have the cage there, they do sell sports goggles as well. But yeah, generally if a child has an injury, to or around their eye, they should be seen by a medical provider. Often what happens is that kids will see their pediatrician for an urgent visit, or sometimes they'll go to the emergency room and they'll kind of be triaged by a general doctor to determine if they need to see an eye doctor. But there are some kind of subtle examination findings that can be pretty serious as a result of trauma that require an eye doctor. So I'd say we generally have a pretty low threshold if there's any type of projectile injury around the eye that the child should see an eye doctor.
Okay. I was just thinking about the one time this kid threw a rock and it literally almost missed my eye, but I didn't know that was coming.
Yeah, exactly. Tough. Especially some kids, don't really complain, and so they might like have blurry vision afterwards, or might be light sensitive and don't say anything. So we're always happy to see them.
Yeah. So, Dr. Oates, what advice would you give parents navigating their child's first pair of glasses? And Shavette, you can weigh in on this too. And what should parents expect in the long run when their children are prescribed eyeglasses? I know we mentioned earlier about how sometimes those kids don't want to wear those glasses. I know I was worried about getting made fun of because, people they want to call you names and come up with jokes in school.
Totally. Well, one question that I get often from the parents of my patients is, how do you know my kid needs glasses? Well, I'll see like a 6-month-old and prescribe them glasses. And they say, how can you tell that the 6-month-old needs glasses? And so I just like to share that there is a kind of separate test that we do for kids that aren't able to communicate. And it's an objective test where we use a specialized light to look at the reflection of light in their eyes. And then we use special different powered lenses to kind of neutralize that light. And that's how we're able to tell. So Shamika, if you went to the eye doctor, the doctor would say, here's the chart, 1 or 2, which is better. Until you stop saying 1 or 2, they give you the glasses based on that. Kid, we have kind of an objective way that doesn't rely on them kind of talking or cooperating with the exam. So that's the first thing I tell parents. And then in terms of actually wearing the glasses, if you have that child that has the magic moment, it's perfect. There are some kids that, love their glasses and never take them off. But if you have a kid, maybe like baby Shamika, who is a little bit worried about getting made fun of, there's a few different strategies I recommend for parents. One is to associate it with positive things. So maybe if you limit your child's screen time, you give them the screen when they're wearing their glasses, so they have a kind of a positive association. Sometimes parents have a sticker chart where they get a certain number of stickers for the hours that they wear their glasses, and then there's a reward when they have a certain number of stickers. I've had some very dedicated siblings who have bought plain glasses with no power in them and worn them in solidarity so that their sibling gets excited or feels comfortable with it, or even putting a pair of glasses on a stuffed animal or a doll can be helpful. And then finally, just making sure that you're doing everything you can to optimize the fit for the glasses. So there are specialized brands and styles for younger children. They're often kind of a flexible plastic instead of the like rigid metal frames that a lot of adults will get. They often have a little strap around the back that helps the glasses stay on. And they sometimes have to be changed once or twice a year as the child's face grows to make sure that they're fitting the child correctly and that it's not a sensory issue where the glasses help the child see, but it makes their nose feel uncomfortable or something like that.
Well, there's some great tips. Shavette, do you have anything to weigh in on that about advice for parents navigating their child's first pair of glasses?
Just a couple. Not much more to add to that other than I wish that I knew the name of this school system. There's a school system here in Georgia that actually started a I Wear My Glasses club here that makes the kids feel really special about wearing their glasses. And I thought it was the coolest thing. I wish I could remember the school system so I could shout them out. But I also know that on our website, we have a resource list of books that kids can read and parents can read to their children about just how cool it is to wear your glasses if they're prescribed. And it is a great list of books.
Oh, that's awesome. I wish that was around back then. Well, we got to talk about contact lenses. Dr. Oates, what advice would you give to parents who are navigating their child's first contact lenses? And I see my mother is in the chat, so I can already I feel the eye roll because we had a battle. So
it's a great question because, a lot of kids, especially if they're worried about the stigma of glasses, are interested in contact lenses. So when I have a parent ask me about contact lenses for their child, in front of the child, this is what I say. A child that's ready to wear contact lenses is a child that leaves their room really neat, always knows where all of their things are, remembers to wash their hands after they go to the bathroom without being reminded, is able to remember to brush their teeth twice a day. So I give them a little list. And usually after the first or second thing, I can look at the parent and the child and see whether it's a yes or a no. So essentially, the child has to be pretty responsible. The child has to be able to have contact lens solution with them at all times. They have to be able to keep track of a contact lens case. They have to know what to do if a contact lens falls out of their eye when they're in school, when they're not with their parent. So I would say most kids are ready maybe around 9 years at the younger side, and then maybe up to 12 years at the older side. It really can depend on the child's personality, how motivated they are. There's also the practical point that the child has to be comfortable putting their finger essentially on their eyeball. And, we got some kids that really just like you get within an inch and they just shut their eyes and don't open them again. So I don't know, Shamika, you're laughing. So I don't know if that's what kind of kid you were. Maybe I
wanted to go to the emergency room to get them out because I was like, I can't get them out. Once they're in, I cannot get them out. But I had to wait till, honestly, I think like 12th grade before I got them.
Yeah, so it's super dependent on the child and the family. And of course, there's no pressure. Usually the only pressure that's coming is from the kid that wants to wear them.
Yeah. Yeah. Shavette, did you have anything to add to the contact lens stories?
No, the kids are working where they're a little young.
Okay. All right.
I haven't asked for them yet.
Well, Dr. Oates, as we wrap up, are there any other recent advancements or technologies in pediatric ophthalmology that are improving how we diagnose or treat childhood vision problems, and what should parents know?
Yeah, we've been doing the same type of screening device for, 20, 30 years. And in 2019, it was the first time we got a FDA approved screening device that uses kind of a different mechanism. The device is called the Blink. It looks like a little volleyball. It's another handheld screening device. It's not quite in wide use yet, but its technology is a little bit more advanced than kind of traditional instrument-based screening and has the potential to kind of improve the specificity of screening, meaning that less kids that have a normal eye exam would be referred. So that's a newer technology that might be entering pediatricians' offices in the next 5 years or so.
Okay. Well, for the people that are watching, what do you want them to leave this conversation? This has been a great conversation. What do you want them to leave with? One important thing to take with them from this whole thing? Shavette, I'll start with you.
Vision screening is important, it's safe, and it's a wonderful thing for your kids.
Short and sweet. Yeah, do you want to tell people how, if they are in Georgia, where they can find more information, what your website is?
Georgia.preventblindness.org.
Okay, thank you. Dr. Oates, how about you? What do you want to leave people with tonight?
Yeah, mine is similar, and it kind of takes me back to the first question you asked me, which is why is it important to do this early? And thinking about young kids have a high risk of developing eye problems that will be asymptomatic, meaning there's no way to know that they'll have them unless they're screened. So really focusing on early prevention, getting kids when their brain is still kind of flexible and developing, and we're able to effectively treat these conditions.
Thank you. I want to thank both of you for joining me tonight here on blackdoctor.org, Seeing Eye to Eye. This has been a great conversation. And everyone watching, for more information about eye health, you can head over to blackdoctor.org because there's a lot of resources over there. And as Shavette mentioned, if you missed it, you can run this back because this is recorded as well. So you can run it back to get that website. Thank you both again. And, you guys got to come back for another chat sometime. So thank you and have a great evening, everyone.
Thank you.
Thanks for having us. It was great to speak with you.
Thank you.
Bye-bye.